Overwhelmingly, eyelid surgery is very safe. I spend the vast majority of my time doing anything and everything possible to prevent and minimize all risks. That being said, all medical interventions have not just benefits, but also risks and alternatives. This video explains the risks to eyelid surgery, even for the more major procedures that I do. When you come in, we'll have a conversation that is specific to you, your anatomy, and your condition. In general, the risks to eyelid surgery include, but are not limited to, bleeding, infection, asymmetry, scarring, wound dehiscence, a kinked eyelid, an eyelid that is too open or not open enough, the need for further surgeries, loss of vision, blindness, perforation of the eyeball, injury to the eyeball, respiratory depression, and even death. Some patients may have difficulty with dryness or exposure keratopathy when the eyelid is having difficulty closing. Eye drops and ointments may be necessary indefinitely. Other risks include not completely treating the condition. An alternative to surgery is observation or monitoring the condition with photographs. However, your condition may worsen and cause other problems. There are certain medications that can increase the risk of surgery. These include baby aspirin, Advil, Motrin, ibuprofen, Aleve, naproxen, and multivitamins, flaxseed oil, fish oil, and vitamin E. I'll give you a list of medications, and I need you to carefully review that list to make sure that none of your over-the-counter medications, vitamins, or herbal supplements are on that list. Anticoagulants such as baby aspirin, Coumadin, warfarin, Plavix, Xarelto, Eliquis, and Pradaxa must be managed by the doctor or cardiologist that prescribe them to you. There are severe complications associated with stopping these medications, and they should be stopped by the doctor under direct supervision by the doctor that prescribed them to you. In order to minimize the risks associated with these medications, it's up to that doctor to tell you when to start and stop and restart those medications. If we're doing your procedure with anesthesia, then you can eat dinner the night before the surgery, but you can't put anything in your mouth after midnight the day of your surgery. Also, since we're operating on your eyelids, you're going to need a ride home from the operating room center. In general, I instruct the anesthesiologist that I work with to give you the minimum amount of anesthesia that will make you completely comfortable and minimize the risks of anesthesia. The anesthesiologist will review the risks of anesthesia with you, but in general, they always include nausea, vomiting, breathing problems, stroke, and death. It's important during your preoperative appointment that we have this conversation specifically as it relates to you, your condition, and your concerns. If I haven't answered all your questions, or if you have any other questions, please make sure that you address them with me. You can write them down, call the office, and make sure that we answer them to your complete satisfaction. I want to make sure that you understand everything that's involved with surgery. Please also explain to me what your expectations are to make sure that they're in line with my expected outcomes. Overall, I'm very conservative when it comes to surgery, and I always prefer a safer, more refined surgery rather than a dramatic total makeover. My goal is safety first and a subtle but dramatic improvement with cosmetic procedures. We'll give you a printed out version of this conversation for you to go over. After surgery, you'll have my personal cell phone number, which is 347-556-2100. And you should know to call me if you have any questions or concerns. We'll also give you the instructions for what to do before and after the surgery printed out. As I said before, eyelid surgery is overwhelmingly safe, and I put together this video so that you can be informed about what to avoid to minimize any of the risks. Also, like I said before, safety is always my number one first priority, and I'm constantly and actively looking for the safest way to do that in the best manner for patients. So if you have any questions, please feel free to call or email the office anytime. We're here to help, and we wish you the best.